Hi everyone, we are here today to discuss on a rather large problem that the whole world is facing for the nearly 3 to 4 decades since changes in lifestyle started happening, and the whole generation has changed to be larger, and the problem is also pretty large. Yes, it's the first pandemic that I started to worry as an anesthetist. It's called the obesity, and it's certainly catching up on the pregnant population more and more, giving us more comorbidities to deal with. So today, the next few minutes, we're going to look at what are the problems when the mothers have to face when they have compounded problem of being pregnant and obese, and how as an obstetrician and anesthetist we can tackle this. So obesity plus pregnancy. The changes that happen in the body are pretty complex, and henceforth they are challenging bunch of people to actually manage in a clinical scenario. Pregnancy by itself is a very physiologically demanding scenario, having to meet the demands from the fetus, and the mother is actually getting ready to deliver a baby using all her resources from herself. There's a raised basal metabolic rate, cardiac output, and the hormonal changes actually have to match this so that she actually still is physiological, maintaining her end organ perfusion and all the hormones and enzymes in her body. However, when she has pregnancy itself can actually have a derangement, but when she is obese, we have categories in obesity. Anyone with the BMI greater than 30 is considered to be obese, and you have mild, moderate or severe, and then comes the morbidly obese patient. So we are particularly worried about the severe obesity and the morbidly obese because it's become quite common to see the mild and moderate patients in our clinical practice. But still, they do still have the changes happening in their body, and we have to be aware of that. Multi-system effects happen with a significant impact on the hypothalamo-pituitary axis, and we often see the Cushingoid appearance of these patients, and you know that their stress response, their response to any sort of complication that's going to happen is going to be modified. It's not going to be a straightforward patient, and it's definitely have a very significant effect on the cardiovascular system. So the risk profile as described in different literature and particularly in the American College of Guidelines says that the lowest risk is with a BMI of 30 to 35. So this, we are just talking about the obese population. So 30 to 35, we can actually manage them, control the risk profile, ensure antenatally they are well prepared intrapartum as well as postpartum, and we can actually reduce the morbidity and mortality. The medium risk is a BMI between 35 and 39.9, and the highest risk is for the BMI greater than 40 and above.